Hey guys, this is Dr. Hub. Now let's look at the Hesselbachs triangle. So first let's label the Hesselbachs triangle. So what are we seeing here? So this structure right here, this is nothing but the transversalis muscle. So it is the transversalis muscle. Next there is a ligament below. So what is this ligament? This ligament is nothing but it is a inguinal ligament. It is the inguinal ligament. And next is the presence of the external iliac artery and the vein. So this is nothing but the external iliac artery. We are writing it as EIA, and on the other hand there is a external iliac vein, that is a EIV. Next, this structure right here, it is nothing but the femoral ring. So let's write it as F ring, and on the bottom side there is a ligament. This ligament is known as the lacunar ligament. There is a prominent muscle which is present here, that is the rectus abdominis. We are writing it as RAB, and there are some vessels which are projected here. These vessels are nothing but the inferior epigastric vessels. So let's write it down, inferior epigastric. So it is the inferior epigastric vessels. So these are the main labelings which we need to know as we proceed ahead. So what is present laterally? So laterally there is presence of the inferior epigastric artery. So laterally there is the inferior epigastric artery. So this vessels, this is nothing but laterally. So we have this laterally, and then medially is the lateral border of the rectus abdominis. So medially there is a laterally, so medially there is a lateral border of the rectus abdominis. Then inferiorly, what do we have? Inferiorly it is the inguinal ligament. So this is nothing but inferior. So inferiorly there is presence of the inguinal ligament. So the direct inguinal hernia, it emerges from the Hesselbachs triangle. So there are some important points. So what we are saying here is there is a direct inguinal hernia. So let's write it as DI hernia. So this direct inguinal hernia, it emerges from the Hesselbachs triangle. So it emerges from the Hesselbachs triangle. So hence it is situated medial to the inferior epigastric artery. So it is situated medial to the inferior epigastric artery. Then comes the presence of the indirect inguinal hernia. So the indirect inguinal hernia, it enters the deep inguinal ring, and hence it is a lateral to the inferior epigastric artery. So it is lateral to the inferior epigastric artery. So there are some important points to note.